Let us bring in Igor Volsky of the Center for American Progress and co-author of Howard Dean's Prescription for Real Healthcare Reform. Governor Dean's supposed to join us, but lousy American infrastructure, delayed by flights. But we're happy to have you, Igor. Thank you. As well as Georgia Republican Congressman and Dr. Tom Price. Representative and Dr. Price, I want to begin with you. And without slipping too far into the politics of Obamacare, okay, because I know it's easy to do, what do you think the Supreme Court is going to do? It's all going to come down, as people I've talked to have suggested, to Justices Kennedy and maybe even Roberts.
I think you're right, Brian. Well, as a physician, I can tell you that I believe that the law it violates all of the principles that we hold dear on health care. But the constitutional issue, I believe, is the individual mandate. And it's not that the government says you have to buy health insurance. It's that this law says you must buy a product, and this is what it must be. And the law clearly defines in very specific ways what every single health coverage plan must have. So specific that no single member of Congress's health coverage right now would be compliant under the law. It would be illegal. And that's what I believe to be unconstitutional. I think that's what the court's going to find. And the question that Pete raised is very, very important. If the individual mandate comes down, do all the other things stand within it? Because if it does, then it puts us in a very difficult situation, because the prices would significantly increase for everybody as community rating and guaranteed issue and those kinds of things that only work if you think they work if the individual mandate's in place.
Fair enough. But Igor, and listen, I know you guys discussed the public option in your excellent book. Those who are in favor of the law and would disagree with the congressman will say this: people who do not have insurance are still engaged in commerce because they are costing everybody else money by going to the doctor or the emergency room without health insurance.
Precisely. There's a tremendous cost shift that's borne by everyone in all the different states, and that's where the argument about interstate commerce and the cost of insurance going all across the nation. It's interesting because on Tuesday, Congress voted to repeal a board, the IPAB, that was in the law. But before they did that, they took out language in their own bill that specifically made this very rationale, that healthcare costs can be regulated under the interstate Commerce Clause in the Constitution, the Commerce Clause in the Constitution. They took it out because they thought, you know what, this might be giving too much to the defenders of the law. But I think everyone really admits that healthcare costs are a problem, and the fact that people are uninsured shifts those costs all over, and that the government needs to find a way to control that kind of spending.
And the big debate, Congressman, of course, and you're a doctor, don't need to tell you this, is will this law bring down medical costs or make them skyrocket? You know, and everybody's got a different worldview. Maybe we won't know if the law is enacted until 2014. But as an opponent of the law, if the Supreme Court says some is constitutional, some is not, would you be happy with a severing of the law, some in, some out?
No, I don't think the rest of the law works if you don't have the individual mandate, and I think the individual mandate's unconstitutional. The flaw in the argument is that this is the only way to solve the problem. The fact of the matter is there are wonderful patient-centered solutions that can get every single American covered with the health coverage that they want for themselves, not that the government wants for them, that solves the insurance challenges of portability and pre-existing. You ought not lose your insurance if you change your job or you lose your job, and you ought not be priced out of the market if you have an awful diagnosis or an awful injury. But you don't have to put the government in charge to solve it.
I'll give you quick the last word, Igor. Are you in favor of the Medicaid expansion? If so, why?
Well, I am. I think it really gives people who are lower income a chance to find affordable coverage. But I think the only patient-centered option that has worked in the states is actually here in Massachusetts when Governor Romney enacted the law here. It's very similar, as we know, to the Affordable Care Act that has the mandate. And here we have, of course, 99% insurance rate, and now they're dealing with costs. But even the costs for the expanded population seem to be contained. So, you know, if it's a template for the nation, I think it's a good way to go.
Huge access problems. H.R. 3000 is the solution. Patient-centered health care.
All right, Congressman Tom Price and Igor Volsky. Gentlemen, both, thank you. Have a good weekend.
Thank you.